Well, this is a sobering story we're going to talk about here. Jill Hanson Holker is a Utah mother of three and a dedicated nurse working in an intensive care unit in Utah County. She's been caring for COVID-stricken patients this year.
But now she's fighting for her life. Salt Lake Tribune columnist Robert Gehrke joins us live to tell us more about her battle to survive. And Robert, full disclosure here, I actually know Jill and her family. I've known them for several years. She's been very dedicated in her profession, taking care of patients. And overall, she's been very healthy as well. So this really hits hard.
Yeah, I didn't know you knew him. It's a tragic story, really. As you mentioned, she has three kids. And you know, she was caring for these patients for months and months, and then you know, end of October, first part of November, she gets infected herself and ends up in the hospital. And her condition has deteriorated to the point where she was on they call them ECMO machines. It takes the blood out of your system, oxygenates it, puts it back in. They use them during transplants and so forth, but she was on one of those and just wasn't getting better. And so she's been transferred now to a clinic in Florida that specializes in lung care. They've done double lung transplants, and there's a potential that she's going to have one of these. And she's, you know, as I mentioned, she's one of 13 healthcare providers in the state who've, you know, well, 13 have died. There's been 330 who've been hospitalized with COVID symptoms. And these people are, you know, day in, day out, putting their lives on the line, putting themselves at tremendous risk to care for coronavirus patients in our communities.
Now, Robert, there are a lot of stories like this. Why did you decide to write about Jill's in particular? I mean, the pictures on the article as well are really sobering, but why did you choose to write about this?
Yeah, I mean, I think this one this one hit home for me. It drove home the point. You know, as you mentioned, the pictures, you can kind of see how devastating this is to an otherwise healthy young woman. You know, and we've got this, you know, today we've got the great news that vaccinations are beginning in this country. They'll be starting here probably tomorrow. And so, you know, we can see the light at the end of the tunnel, but for so many people like Jill, they're still going to be dealing with this. And so I thought it was important to drive home the point that for these next few months, we've got to maintain focus on doing the things that we know work. And that means, you know, the social distancing, that means the masking, and you know, and we really need to appreciate the sacrifices our doctors and nurses are making.
Yeah, I definitely think that goes without saying. I know Jill's daughter had posted on social media how people need to take this seriously, and you talked about the great sacrifice that nurses make on behalf of these patients. So with Jill, it was just so surprising because for people who know her, she was so healthy, and you knew she went in every day taking care of these critical patients, not thinking that she would get COVID herself and it would impact her so greatly like this.
Yeah. I mean, and it's there's so many people like her and who have made these sacrifices to try to care for other people, to keep people alive. You know, and I, you know, said in the column, I think it's important that the best way we can thank these people for the sacrifices they've made is to do the things that we know, you know, curb the spread of the virus. And also, you know, as I mentioned in the column as well, Jill's family has a lot of medical bills. They've set up, there's a GoFundMe that's set up for the medical expenses and the child care expenses. And so I'd encourage people to go in and give what they can. It's going to be a tough Christmas for Jill's family.
Well, I think also we can judge ourselves by how willing we are to help out the helpers during this time right now. So the article is in today's Salt Lake Tribune. It's an editorial by none other than Robert Gehrke. Thanks a lot for taking the time for us. Appreciate it, Robert.